Hi, I'm Dr. Stan Steindl. Welcome back to Compassion in a T-shirt, now available in video format on my YouTube channel, in case you want to get a visual on me and my guests, and on podcast, in case you prefer to listen while you walk, drive, or do your chores. Today, my very special guest is Dr. Stephen Trzeciak. Dr. Trzeciak is a physician scientist, professor, and chair of medicine at the Cooper Medical School of Rowan University. He also serves as chief of medicine at Cooper University Healthcare. As an interventionist and clinical researcher, Dr. Trzeciak has over 120 scientific publications to his name, mostly in the field of resuscitation science. Currently, his research also focuses on compassionomics, studying the scientific effects of compassion on patients, patient care, and healthcare providers. He is co-author, along with Dr. Anthony Mazzarelli, of the best-selling books Compassionomics, the revolutionary scientific evidence that caring makes a difference, and Wonder Drug, 7 scientifically proven ways that serving others is the best medicine for yourself. Dr. Trzeciak's mission is to make healthcare more compassionate through science. I'm thrilled to explore this vital topic with him, and so I bring you Dr. Stephen Trzeciak. Well, Dr. Stephen Trzeciak, welcome to Compassion in a T-shirt.
Thank you so much, Stan. It's a pleasure to be here, and I'm grateful for the invitation.
It's lovely. Good. You've done a lot of research and kind of concluded, I think, that we're in a bit of a compassion crisis, I suppose. I wondered if we could just start there. What do you mean by compassion crisis, and what's some of the data that you're looking at with that?
So I like to be evidence-based. I'm a physician scientist by background, so I'm a research nerd. And so I don't like to make claims without data to back it up. And so the data that I'll share with you, the only caveat is that they're from the US. And so for an
Mm.
international population, the data might be different. But for example, in the US, a University of Michigan meta-analysis that tracked college age students over 2 decades found that empathy among college age students has been declining over time, and the speed of that decline is actually accelerating. In a study from the Harvard Graduate School of Education of 10,000 youth in the US, so these are middle school or high school students, they found that 80% of our youth believe that their parents value their achievements and their accolades more than the parents value the kids' kindness for others, at least
Hmm.
from the kids' perspective. And then there was a striking Pew Research study from just a few years back, again here in the US, that found that 1/3 of Americans endorse that they don't consider compassion for others to be among their core values that describes them well. And so my work is in healthcare, being a physician, and perhaps that compassion crisis, as I framed it for your consideration, is spilling over into healthcare. There are data for that as well. Even though healthcare is supposed to be different. But the data actually suggests that it's not.
Mm. So one of the trends is really amongst young people, in a sense, youth and college age
Well,
students.
at least, so I would say that there are data on that. The question is whether or not they're just disproportionately studied more. So
Ah.
I don't like to, sometimes I think the younger generation gets a bad rap. You know,
Mm.
I actually think that what the younger generations are looking for is meaningfulness, and they're less apt to tolerate things that are mundane work that don't have a lot of meaning, maybe in contrast to folks our age. But there are data certainly that in young people there are those signals,
Mm.
and they're of course concerning.
Mm. Yes, isn't there a sort of an idea that when the printing press first came in, it was first invented, that
Mm.
empathy increased, I think, because people started to be able to sort of imagine more so, the minds of others, and sort of
Mhm.
being able to read widely, people sort of had that sense of, how others might think or how others might feel, and sort of there was a kind of an increase in empathy. That's coming from the back of my mind somewhere, that idea.
It makes
And
sense.
yeah, and now I don't know. I agree with you. I think that's a really good point. We don't want to sort of talk about various cohorts negatively and so on, but there is this idea of social media, isn't there, and technology, and how that's sort
No
of
doubt.
influencing people.
So
How does that affect empathy, do you
I,
think?
well, I don't know about I don't know about the printing press, Stan.
Yeah.
That makes sense to me. What and this what I'm about to say, I have learned from others. I'm not an expert in this, but as I understand, the algorithms behind social media are specifically designed to um, put you in an echo chamber of messages that would resonate with you, or the algorithm thinks is going to resonate with you. And what I think it contributes to is what I would call tribalism.
Mm,
Us versus them, or us theming activities. And I think we have to be very cautious about that. I think that the algorithms are absolutely, and I would say by design. I'm not. Some people think it's sort of sinister. I don't. I'm not. I'm not sure. Maybe it's just they're trying to make money rather than trying to turn people against each other. But there, it's an echo chamber that definitely leads to tribalism, and I think that it puts a wedge in between people. Again, I'm not an expert in those things, but from my
mm.
reading, that's what I understand.
Yes, it's sort of because we might have empathy for those in our own tribe, and we
Mhm.
might have empathy for people that are very different to us, but that's the one that becomes harder, I guess, as we're being fed more and more of our own information. It's
There was
harder
a
to
book.
empathize.
Yeah, there was a book a few years ago, Against Empathy, and I believe it
Oh,
was
yes,
Paul
Paul Bloom.
Bloom. And
Mm,
my recollection from when I read that was that there's this idea of parochial empathy, meaning if I take care of those who I believe are like me, right? Think like me, look like me, vote like me, all those sorts of things, then on balance, even though the people might take care of those people very well, on balance, if you look at the totality of how they behave towards other people, they behave worse.
mm,
And
mm,
it's this notion of what some researchers call us theming, and
mm,
putting people into the category of the other.
mm,
And for your background in those that are trained as psychologists and in that domain of science, in groups and out groups.
mm,
So yeah, it's something I worry about. I worry about it with my own kids. And it also when I consume content on social media, I'm more skeptical about, like, what how I might be fall victim to some sort of algorithmic manipulation.
mm.
Yeah, I worry
Yeah.
about it. Mhm.
Yes, I'm not an expert on the sort of the effect of the algorithm as well, but it probably isn't a sort of a sinister thing. So it's almost a bit of a mirror in a way. The algorithm just
Mm,
feeds us what we keep looking at, and it just becomes more
that's
and more
for sure.
narrow and
Yeah.
focused, and before we know it, we're in that echo chamber, and we
Mhm.
lose a sense of others, and the empathy for the actual other, the person in the other tribe, or the other in the other, us and them. We sort of lose empathy there. But then there was that second bit about kindness as well. That there's this
Mhm.
sense amongst that group of youth or young people that kindness isn't sort of considered one of the top sort of values, that achievement is more important, and you know what I
Mhm.
do or achieve or that sort of thing, successes is really prioritized over something like kindness.
I recently had the opportunity, I'll say, to witness a high school graduation speech. I won't say what high school it was. It wasn't my kid's high school. And what was striking, it was a very large high school, prominent in the region. And the message from the valedictorian of the class was, it's all about you.
Mm.
It's all about you. And, as I recall, I was not valedictorian of my class, but as I recall what the messages were, it was something like serve something greater than yourself. Um,
Mm.
and so the question is, what is truth in that? My colleague and co-author, Dr. Anthony Mazzarelli, and I, we actually studied this, not in healthcare, just for regular people. Like, what is the evidence-based way to live your life? Should it be all about meism, or should we be live to givers, as we like to say? And, we curated over 250 original science research papers that show, I believe, we laid out a case. I believe it's compelling, and readers have as well, that the that serving others actually is the best medicine for yourself. And that's not a pithy bumper sticker or a fairy tale or anything like that. It is supported by rigorous science, that when you are in the mode of serving others and not focused on yourself, your physical health can be better. Now, of course, we're talking about sustained over time, consistency over your lifetime. It's not a one and done.
Hmm.
That would be like, if I eat my vegetables once, I'll live till I'm 90. No, of course, you have to have good habits throughout your entire life. Just to be clear, to all your uh, viewers and listeners. But it also helps us get out of our own head and helps us with our mental health. And you're the expert on that in your domain. It also helps us with happiness and well-being. And so there is a lot of evidence that what I witnessed from that valedictorian speech is, it's all about you, it's all about me. Take care of yourself. It's actually terrible advice.
Mm. Okay.
And actually, a research intern of mine did a recently published analysis of college graduation speeches and what proportion of the messages were
Oh.
give and serve others versus it's all about you, your success. You can do it. Uh, and it was about 50-50, which was definitely better than the valedictorian speech I was exposed to. But I think going back to what I said about being a researcher, let's be evidence-based about it. And what does the evidence point to? And the evidence actually points to serving others compared to being self-serving, if sustained over time, will give you the results that you seek.
Mm. Yeah, I mean that's sort of a profound bottom line to the research, really, isn't it? You know, that
Well,
if we
it's sort of a central tenet, if you will, to like almost every world religion and cultures all over the globe, that we ought to, from through a moral ethical lens, take care of others. That's the right thing to do, so to speak. But
Mm.
is it just the right thing to do, or is it also the smart thing to do? And
Yeah, that's
that's what we and I don't mean to be clear. What the research also points to is that motives matter. So
yes.
I'm not talking about serving others in some sort of transactional, like give to get kind of way.
Mm.
But if you take what my co-author, Dr. Maz, and I call a live to give mindset rather than a give to get mindset, that sets you up with the best opportunity to reap all the benefits. It's fascinating to me that the research, both neuroimaging research as well as research in health outcomes, mental health outcomes, physical health outcomes, mental health outcomes, shows that if you're in a transactional mode, like what we call strategic helping, that it doesn't work. And so, when I say the smart thing to do, I'm not talking about in some sort of like manipulative sort of way, like, transactional, reciprocal, like, it'll come back to you in some sort of way, but in more of a transformational way, like it transforms your experience when you truly are being altruistic, if that makes sense.
Mm. Yeah, there's really there's twofold benefit, and when you're an authentic kind of live to give kind of mode, and you're able to sustain that really just has a very um, happy sort of consequence for yourself, that you'll actually benefit from that as well. I guess we've as a species, over thousands and hundreds of thousands of millions of years, there's been a bit of a tension between sort of self-serving and other-serving, perhaps, isn't there? It's kind of perhaps
So,
always been a tension.
so I'll say a couple things about that.
Mm,
Um, First, from an evolutionary standpoint, um, folks point to Darwin as a survival of the fittest, promoter.
mm,
First of all, I think as it relates to that saying, it wasn't actually him that said it, but a colleague. But also, he said in, I believe it was The Descent of Man, and I'm paraphrasing, something on the order of those communities that take the best care of each other will survive the best. That's
mm.
paraphrasing, of
Yeah.
course, but he recognized that taking good care of each other was vital to survival of the species, no
Mm,
doubt about it.
yeah.
Um, yeah, and so I think we think of uh, survival of the fittest and serving others as being in tension with each other, but I'm not really sure it is, because
Mm,
the studies of the benefits, psychologically speaking, of altruism and the mental health benefits that go along with that, happiness and well-being from leading an other serving life rather than the self-serving life. I believe it was Dr. Sarah Conrath that studied this across, and colleagues across many different cultures, like all over the world, and it was virtually it was homogeneous, that this signal um, rings true in every corner of the globe. And if that's the case, then to me it seems like, and this is not my area of expertise, it's just what I've read of other people's work. It seems that if it's everywhere and it's almost like a universal, that there must be something down in our DNA which gives us a benefit from helping and serving others. I'm not
mm,
suggesting that by nature people aren't self-interested. I actually
mm,
think people are self-interested by nature. I think we're all self-interested by nature, and we have to fight against that. But what the research shows is that if you can make yourself not self-interested and other oriented, that the benefits you will experience are available to everybody.
mm. Yes, it sort of depends on how you define fittest. And when it comes to humans, the
That's
fittest are
right.
the ones who perhaps are other focused and community focused and looking after each other and giving, and those are the ones that will kind of flourish, I guess, as according to
Mm-hmm.
Darwin. Um, so we've got empathy. Empathy's kind of had some interesting changes perhaps recently in literature, or maybe there's this decline.
Mm-hmm.
We've got kindness, I guess, kindness as an action, and you mentioned live to give as a sort of one little kind of catchphrase way to sort of think about it. But so how are you pulling all that together to define compassion, really, for you? Do you have a kind of a
So,
pithy way to define it?
I don't know about pithy.
Okay,
People get really emotional about these
they do.
definitions, don't they?
Yeah.
Do you understand it? Because I don't. Like, I don't get worked up over the definitions as long as you make your definition clear so everyone knows what it is that you're doing in your research studies. Does that
Yes.
make
Yeah.
sense?
Yeah,
But
no,
I
it
don't
is. It's
get,
funny. It's almost a little bit competitive, isn't it? The same tribalism can come in around how do we define compassion?
I was just going to say that it's so ironic that there's a
Yes.
tribalism within the research community on compassion about how to define compassion. If we
Yeah.
have compassion, I thought we shouldn't have tribalism, but whatever.
Yeah.
That's a discussion we can have a different day.
Yeah.
I will tell you how we define these things operationally in the research group that we have here at Cooper in the U.S. And so I recognize definitions are heterogeneous. And again, people feel very passionately about this. I just don't share the passion. We just need clarity is what we need. So we adopt, because we've taken this from other researchers, compassion as a definition is the emotional response to another's pain or suffering involving an authentic desire to help. So it is a responsive action to another person's pain, suffering, or struggle.
Hmm.
And the distinction that we would make is that the closely related word empathy is a bit different in that it is the sensing, detecting, feeling, and understanding component of understanding another person's pain, suffering, or struggle. So, of course, empathy is vitally important because if you don't sense, detect, feel, or understand the opportunity, you will miss 100% of those opportunities to respond to people with compassion, whether it's in the context of healthcare or otherwise. So empathy is vital. But the way we define it, compassion goes beyond empathy because it involves taking responsive action when you identify those opportunities. So the way that we like to think about it, and some people would think of this as overly simplistic, but that's okay for me. Empathy plus action equals compassion.
Hmm.
Empathy plus action equals compassion. And I think this is the most important thing, Stan, is that it's not just so nomenclature is important in any scientific pursuit, no doubt about it. But it's not just semantics for the distinction in terms. There's actually neuroscience data behind it. So using functional MRI brain scans, so it tells us what part of the brain is being activated at any given moment in time. When you bear witness to suffering, the part of the brain that is activated, that lights up on the brain scans, is what neuroscience researchers would consider to be a pain center of the brain. Pain center. So there are neuroscience data to support the saying, I feel your pain. That's not just a politician's slogan, so to speak. Right? There's actually neuroscience that you feel another person's pain. And we all know this experientially because it's very uncomfortable to watch people suffer.
Hmm.
But in contrast, using the same brain imaging modality, so functional MRI, when a person's mind is focused on action, helping, serving, doing whatever they need to do to alleviate another person's pain, suffering, or struggle to whatever extent is possible. When you're focused on that, a distinctly different neural structure lights up. And those same neuroscience researchers define that as a reward center of the brain, reward. So there
Hmm.
is, uh, some people have extrapolated that to say and again, this may be overly simplistic, but empathy hurts, but compassion heals. But the important thing is that we all know that experientially as well, because unless someone is a sociopath, it everybody knows it feels good to help people.
Mm.
And so those that the activation of the reward center in the brain is we've experienced that before. And it's just part of the reason why it feels good to help people. There are a bunch of other reasons, but I don't get super caught up in the definition distinction as long as we have clarity about how we're defining the terms and how we're using them. So when somebody's reading your research, my research, anybody's research, we know what they actually studied.
Mm. Yes, it's almost like the empathy and the pain center of the brain is part of what might motivate us towards action. You know, we're sort of feeling it, and so we sort of want to help. And then the reward center of the brain, the kind of positive feeling that arises out of that, kind of then reinforces that behavior so that we do it again or something like that. It seems like there are a pigeon pair there that work together.
Yes, and one of the more fascinating areas of this, and this comes up in healthcare all the time, because in healthcare, the research often points to something called, and I believe this is actually a misnomer when I use this term. So they talk about compassion fatigue.
Mm.
And I actually think a better description is empathy fatigue.
Mm.
Because if you get repeated exposure to people who are suffering, of course that takes a toll on you. I mean, I'm not a psychologist like you are, but it's intuitive, and I've experienced this myself as a clinician. It takes a toll on you, no doubt. But at the same time, and I believe it's Dr. Tanya Singer in Germany, who is a neuroscience researcher who framed this term that I use quite often is self-other distinction. Self-other distinction. So, for example, so I'm a physician, in addition to being a researcher and chair of the Department of Medicine here at Cooper Medical School. I practice critical care. So I'm an ICU physician, adult ICU, intensive care unit. And so my colleagues and I, we routinely meet people and their families on what they would consider to be the worst day of their life. No doubt. That repeatedly can take a toll on you, and it can be a component of the burnout syndrome, which has been studied extensively now in many different fields, including healthcare, but it's certainly not a unique to healthcare sort of thing. However, while it can certainly take a toll on you, self-other distinction would say this is a tragedy. If I'm facing a patient or their family with great loss, this is a tragedy, but it's not my tragedy. So I can be respectful of the fact that they're experiencing a tragedy, and yet there is no requirement for me to vicariously experience that tragedy, right? Instead, if I focus on my mind on what things I can do to help them in their time of need, however small it may be. And let me tell you, after 25 years of working in the ICU stand, that I can tell you that sometimes when people are facing great tragedy, small things are incredibly meaningful to them. And if we focus on those things that we can do, then we are more likely to not, or we won't vicariously experience the trauma. And over the long view, it can be much better for our own mental health and well-being as caregivers in those moments.
Mm. Yes, Professor Paul
Doctor, by
Gill.
the way,
Yeah.
Sir William Osler, who is many people consider to be one of the fathers of modern medicine, so to speak. He was a Canadian physician who um, uh, was the original founders of Johns Hopkins University School of Medicine, which is one of the most here in the U.S. is one of the most prestigious institutions. He used to talk about, in his writings, would talk about um, a um, a a distancing, if you will. However, I've read his writings myself, and he doesn't talk about not caring. He's basically telling you, you don't have to vicariously experience the trauma yourself. Just focus on the things that you can do to help them. And if you just focus on that, it doesn't take such a toll on you.
Mm-hmm. Hmm. Yes, we're
He
trying
actually
to.
called it, his term was detached concern, which
Hmm.
some people have interpreted that over time as incorrectly interpreted, in my humble opinion. This is just my opinion now. Other people feel differently about it. They've interpreted detached concern to be, well, don't care too much, you know, uh, pull back, detach, don't care too much and keep a distance, rather than care deeply, but be mindful of the fact that you're not the one going through the tragedy. So just focus on what you can do that is helpful to them and meaningful to them, and focus on that rather than focusing on their pain.
Hmm. Yes, there's sort of those two components. I think Paul Gilbert sort of talks about there's an algorithm there. There's a stimulus and a response. There's a detecting the suffering, noticing the suffering, kind of understanding it, bringing empathy to the suffering, and then there's a response, which is sort of some sort of helpful action. And often the burnout sort of kind of arises when the stimulus detection is kind of working, but it's difficult to do anything, or we feel like we're kind of unable to help, basically, I
A
suppose. And
100%, a
yeah.
100%. I absolutely agree with that. And so that's why it's so important to find little ways to make a meaningful difference, even when it seems that you can't. So the burnout syndrome, for example, as originally described, has three components. And I need to, I try to make sure I always say this. It's not a healthcare thing,
Hmm.
because healthcare is just the domain in which so much of the research has been done. But there's nothing unique about putting on scrubs like I'm wearing right now and going to a hospital that makes you prone to burnout. I mean, burnout is everywhere, especially after years of a pandemic.
Hmm.
Anybody can feel burned out. And the three components of burnout, from going way back to the original research, the three things are emotional exhaustion, depersonalization, so an inability to make a personal connection, and then the third thing is the feeling like you're not really making a difference. And that aligns with what you just said and what I was saying just before that.
Hmm.
Is finding a way to make a difference is really protective, if you will,
Hmm.
for the one who is the caregivers, of the people going through the event.
Hmm. Not only protective, but that's perhaps the bit that is really helpful for the
Of
compassionate
course,
person. That's the part that
absolutely.
helps them to kind of thrive, psychologically or
So
physically.
I'll tell you a story, and this just happened, not that long ago, and so it's on the front of my mind. It's not the greatest analogy, but it's the best sort of story I can tell you right now that um, uh, encompasses what I'm trying to communicate. So I work in an ICU. So these patients are critically ill on some sort of life-sustaining therapies, or perhaps at risk for needing a life-sustaining therapy. And I had a critical care service, so about 15 patients in all that I'm responsible for with my colleagues and my trainees, basically. And it was a particularly, I say this respectfully to the patients, but it was a depressing service because just about every patient had a problem that was not fixable. And when I say not fixable, I'm talking about a prognosis that was extremely poor, and a high proportion. It seemed like virtually all of the patients had a problem that was going to be fatal for them.
Oh.
And so when you feel like you're not making a difference for somebody, it can be many things. Frustrating, is just one small thing, but it's many other things as well. And so there was a gentleman who was on mechanical, he had a grave prognosis. He was on mechanical ventilation. We were able to liberate him from the ventilator, take his breathing tube out. He was breathing on his own. I knew his prognosis. He knew his prognosis. He had been on the ventilator for a really, really long time. And when that happens, people get extremely weak, extremely fast. And so this gentleman, we were making rounds with the trainees, and they were presenting patients, and I was doing teaching rounds as well as we were doing the patient care activities. And as one of the trainees was presenting a case, and my colleague was answering all the questions for the trainee to make a care plan for the day, I noticed out of the corner of my eye, this gentleman was trying to eat breakfast. Okay. And he was spooning his eggs. He was trying to get them up to his mouth, and he couldn't do it. And it was incredibly frustrating for him. And this poor guy is an elderly gentleman with a bad diagnosis. All he wanted to do was eat his eggs. I mean, that was all he wanted, right? And so while my colleague was taking care of the patient care activities, I went in the patient's room and I helped him eat his eggs. I spooned him some eggs for him, right? And I got this grin that I got from him, like you would have thought that that it was something much more significant, but that's all he needed. That he was hungry. We had a little, back and forth as I helped him to eat his eggs, and he thanked me. And so this story is not about me, by the way. Okay. It's about one of my trainees who said to me, Dr. T, you don't need to feed him his eggs. Like, we've got other support folks on the team that can do that. And I just looked at him and I said, dude, you don't get it. You don't get it. This is my only chance to be helpful to him today. Right. And I went back later on the day. We had a nice chat. He and I, it seemed to be meaningful for him. As I recall, the details are a little vague because it was several months back now, but I don't know that he had any family that was visiting. The point is, look for the little things. Like, you might think they're little, but they're not little to the person on the other end that's going through whatever they're going through. And it's meaningful not only in instrumental support, like he wanted to eat for nourishment. No, it was the gesture that I was helping with. It was helpful it was meaningful to him. I tried to communicate to my trainee. Now, granted, I've been doing this in the IC for 25 years, and he probably had been doing it for 25 days or something like that, right? But I was trying to communicate to him, find little ways to make a difference that's meaningful, even if you can't fix the problem. And that's the key to, sustaining yourself when you're surrounded by really, really heavy, um, you know, events.
Mm. Yeah, it's actually a fantastic analogy, isn't it? Because it really speaks to what we can all do in a way, when
Well,
it
in your
comes to
practice,
compassion.
I mean, you probably take care of, I would imagine, very patients who have very complex care needs in your practice, where you know that you can't, you know, snap your fingers and fix all that ails them, right? But if nothing else in your therapy, you can let them know that you care about them, right?
Mm.
That they're meaningful to you, that they matter to you. And you can do little things um, that give them hope,
Mm.
right? They give them hope. I mean, I think hope gets a bad rap. We talk about hope as if, some sort of Pollyanna wishful thinking, and nothing could be farther from the truth. I mean, there's a whole
Mm.
scientific discipline around hope.
Yes. Yeah.
That hope is it. By the way, it does feel good, so there are good feelings associated with it, but it's not strictly emotional. I mean, going back to hope theory from like 30 years ago or more,
Mm.
that hope matters in meaningful ways, but also in measurable ways. And so, when you, I'm sure in your practice, you've had the same thing. We're just doing something little that's significant for them, even though it doesn't fix all their problems.
Mm. I mean, it's sort of it's the little things. It's the eye contact, the tone of voice, the facial expression, the physical touch, the helpful actions. All of that kind of activates the soothing affiliative system and the parasympathetic nervous system, and it all just helps to kind of create that feeling of safeness and calm and so on for the person. And sometimes that's the most powerful thing that one can do, I guess, in terms of just alleviating a little bit the suffering that the person might be going through in that moment.
And I would call that healing. I
Mm.
mean, at least temporarily, right?
Mm.
Um,
Yeah.
but there's no way it's not meaningful.
Mm.
I mean, anybody
Well,
that discounts things like that, by the way, you and I don't know each other that well yet, but I'm fluent in sarcasm. Okay.
okay.
And so I've managed for the, 40
You've
minutes
done
or so
well.
we've been here that, yeah, but anybody who doesn't believe that there is um, that there are scientific effects of the things that we're talking about, you know, they're not being evidence based.
Mm.
They're just not.
Yeah.
Uh, there's an old saying, thinking's hard, so lots of people judge, right? So if they were to think about and actually evaluate the scientific body of evidence for everything that compassion, empathy, hope, um, it'd be an undeniable signal. Now, I don't mean that it's a panacea, right? I mean,
Mm.
um, but we're talking about measurable effects to some extent in the right context. And uh, oftentimes, the things that we're talking about today get relegated or dismissed to this, what at best some people would call soft science, quote unquote, and
Mm.
nothing could be farther from the truth. I just think that's uh intellectually kind of lazy when people do that. And so before my sarcasm comes out, we can go to the next question.
Well, no, I mean, I think the kind of sort of the final question in a way is really sort of in compassion in healthcare, and I mean, well, to their credit, doctors do have a hell of a lot of things to learn. They've got a lot of the hard
Absolutely.
science to learn as well, I suppose, and
Hmm.
they're needing to juggle many things, and they're trying to understand various results and what that means for treatment plans and sort of navigating very tricky, intellectually complex things. So sometimes they feel like they don't have time for that. They don't have time to sort of spend at the bedside and helping some poor old fellow eat his eggs, or
Yeah.
whatever
Yeah.
it might be.
That's, you know what? That's also not evidence-based.
Which bit's
And
that?
I'm not challenging you, by the way, but tons of people say that. So there was a study published in the Journal of General Internal Medicine, great journal. And one of the components of this study was a survey question to clinicians, physicians specifically, and 56% of the physicians said they don't have time to treat their patients with compassion. 56%. I think that's striking.
Yeah.
But it begs the question, how much time does it actually take?
Uh-huh.
So I'll tell you two studies quickly in the interest of time. One was a study from Johns Hopkins University it was an experimental trial, randomized, 210 patients, the vast majority of whom were survivors of breast cancer. And they randomized these breast cancer survivors to one of two interventions. One was a standard information only consultation with an oncologist, and the other group, the enhanced compassion intervention, had just a little bit more. And the primary outcome measure for this study was anxiety, measured with a very well validated scale to measure anxiety. And if any of your viewers or listeners have had cancer, or they know someone close to them has had cancer, you know that anxiety is a pretty important outcome measure.
Mm.
So what they found is that the enhanced compassion intervention had not just a measurable, but a statistically significant reduction in patients' anxiety level. So the question is, what was the intervention? And it was literally things like, I want you to know that I'm here with you. You're not going to go through this alone. I will be with you each step along the way. And when they measured the time it took to incorporate those messages, those supportive messages, it was 40 seconds. So if we want to be evidence-based about it, and clearly it could take more than that, of course, right? But if we want to be evidence-based about it, to make not just a meaningful but a measurable difference, takes perhaps no longer than 40 seconds. In addition, a separate study from the University of Pennsylvania, and this study randomized participants to 4 different uses of time. And then they measured something that they called time affluence. So that was the feeling like they had plenty of time and they weren't in a hurry. And what they wanted to do was test which of the 4 uses of time changed their time affluence, their feeling like they weren't in a rush. So the 4 uses of time were spending time on yourself, wasting time, getting an unexpected windfall of free time, or the 4th one was spending time helping other people. What they found is only one of the 4 uses of time, spending time helping other people, raised people's time affluence, meaning the feeling like they had plenty of time. So what the authors concluded was giving time gives you time. I would frame it like this. There is something about spending time helping other people that makes you feel differently about the time that you have. So I have been, and I didn't say this earlier, and I should have said this right at the beginning. If you want to meet a work in progress, you're looking at them right here. I am a work in progress, 100%. But I see it now, right? And so I'm working at this every day. And so what they found is that spending time helping other people makes them feel differently about the time that they have. I have been one of those physicians who was so crazy busy in my own head that I perceived I didn't have time for these little things that we're talking about. Not little things, really important things, not little. really important things that take a little bit of time.
Mm.
So what I'm suggesting for your listeners and viewers is that if you're going to be evidence-based about it, it really doesn't take much time. You just think it does. And so if you change your mindset and follow the evidence, you might consider your opportunities a little bit differently. A University of Toronto study found that in everyday life, the average person in everyday life has 9 empathy opportunities every day.
Oh.
And when I think about that, I wonder, like, how many did I already miss today? Um, anyway,
Mm.
when it comes to time, we oftentimes get it wrong.
Uh-huh. Yes. I mean the sort of yes, I'm here with you, you aren't alone. I mean those are very powerful but kind of brief in compassion interventions in a
Brief,
way. And I was sort of
but
thinking that
but it
actually
has to also be true, right? It can't
yes,
just be
okay.
something that it can't just be something you say.
No.
It has to be true,
Yes.
or it's just a saying, and perhaps it'll have no effect on anybody. I
Yes.
just wanted to put that caveat in
Yes, it's again the authenticity piece of it
there.
is really kind of there in the background. I mean, I was thinking in some ways there are opportunities for compassion that actually don't add any time at all because you might need to be conveying a particular message, but it's in how you convey it where the compassion
Mm-hmm.
comes in. So it's sort of the words and the music. You might be giving something more specific as
Right.
feedback clinically, but the tone with which you express that, the facial expression, the eye contact, that's where the compassion is kind of almost along for the ride anyway. So it doesn't actually take
Yeah.
any time, extra time at all.
Some of my colleagues bristle at this discussion that we're having right now. They
Mm,
hate it. And the reason is for exactly what you just said, that really there should be no time dimension at all.
mm,
Meaning, as they say, you can go through your day with a brusque efficiency, letting everybody know how busy you are or how busy you think you are in your head, or you can treat people with compassion. And if I had a stopwatch, you would learn that it really doesn't take any more time. You just think it does.
yes. Yep. Yes. It's sometimes it's all in the tone in a way.
That's right.
But well, an inspiring conversation, Steve. I mean, we started with the compassion crisis, which I suppose was kind of ringing some alarm bells. You know, where's empathy heading? Where's kindness heading? But actually, we've finished in a very hopeful and kind of optimistic place, which is that actually kind of compassion and all of the positive effects that it can bring perhaps takes no time at all. So that there's a lot to sort of ponder there and to think about. I really appreciate the work you're doing and kind of spreading the word really, especially to perhaps help some of the physicians coming through, but all of us really, how we can bring this into our daily lives. If people are wanting to kind of engage with your work, I know you have Compassionomics and Wonder Drug, are two of the books I'm particularly familiar with.
Mhm.
But yeah, how can people engage with your work?
Sure. The easiest way is to go to wonderdrugbook.com, and
Okay.
the resources are there. You can feel free to contact us through the site. And I want to thank you for the opportunity to be here with you. It's been a fabulous conversation, and meaningful to me. So thank you. And I hope your viewers and your listeners found it meaningful as well.
Yeah. Well, Dr. Steve Trzeciak, thank you very much for being on Compassion in a T-shirt.
The pleasure is all mine. Thank you.
Okay, good.